Hello, hello. Welcome back to JMK Depth Connection or Cardano Depth Connection, where we talk about life issues, especially on our health, on our mental health. And today we are going to talk about grief and loss and how to grieve a loss of a pregnancy. Because we know we can't avoid a loss of a pregnancy in one way or another. So welcome. This is why we share our life experiences. Hapa ndio maisha iko. Hapa ndio tunasaidiana. So welcome to one of our live video. So I don't know if you have ever come across for a woman who have lost a pregnancy, either intentionally or not intentionally. But statistics wise, most of the pregnancy loss happen naturally. You have done nothing about it. We have risk factors which can cause loss of a pregnancy. And most of the women, when they lose pregnancy, they tend to hide and not talk. They don't get enough support. Our society, sometimes they may judge them. Have you ever experienced, maybe you see someone having a pregnancy, and within a short time when you meet, you start asking them, how is the baby doing? When did you deliver? Do you know those questions? Sometimes they are so irritating. They can really cause trauma to them. Not that they can, actually, they cause trauma to them. So for pregnant women, it is by God grace, it is by luck that we are able to deliver our babies at term for 9 months. It's not easy. I've been a nursing officer for over 10 years. I've been doing psychotherapy as a clinical psychologist for some time. And the grief and loss for a woman who has lost her pregnancy is so painful. People will tell you this is a baby you have not seen. No. I believe in any pregnancy, there is attachment to that pregnancy. There is no pregnancy that, as we call, accident. It's by us using a selective one to say it's by accident. There was an intention, unless if someone was raped. Because there are two people who are engaged, two lover bands, with an intention to make a life or to have a relationship. So, what do we do when we lose a pregnancy? One, you should process grief as normal, as usual, according to your belief, according to your culture, according to your professional, and also according to your support that you are receiving. Let's say you lose a pregnancy 1 month or even 1 day. It's the same as pregnancy that you lost during delivery. So it's a human being. So let's not forget the attachment we had with that pregnancy or with that unborn child. We call them fetus. So in those fetus, we have attachment. The best way to grieve is to follow the practice that we have as Africans. I know you may not have an opportunity to go and bury the baby. Sometimes we health workers, we may not give you opportunity even to see that lost pregnancy. Maybe it was too small, or the method that was used to terminate or to help you now to clear the conceptual materials. Maybe you are not able to see, but some they are able even to see the baby. So it's good to see if you have that courage. And then you see, don't force yourself to process grief so fast. In DSM-5, and a scientific diagnostic manual that we use in mental health, they say abnormal grief happen when you are past 1 year, when you start exhibiting depression, anxiety, poor coping mechanisms like withdrawal, isolation, not talking to people, drinking, and also saying that I will not get pregnant anymore, I'm not going to have another baby. Those are some of the bad way of coping. and also now not having a meaningful or positive attitude towards life. So when you lose a pregnancy, I know you maybe even have names for that baby. It's your history. Don't fear to say, I lost a pregnancy in this year, because it's from your gynecological history. So when you go to hospital, they will ask you, how many pregnancies have you had? We count even the pregnancies that you have not delivered, maybe alive. We count even the abortion, miscarriage. So people may say people who have lost pregnancy, they have aborted. No, they are naturally way. We have what we call threatened abortion. We have natural miscarriage. We have people with incompetent uterus. We have people with infection, which can lead to a loss of pregnancy. People with the fibroid also, they have like a issue, or now and then they lose their pregnancy. People with the diabetes, sometimes they lose their pregnancy. People also with hypertension, they can lose their pregnancy. So even in the malaria and other infection, so it is a compound or encompasses so many things that can cause someone to lose a pregnancy. So in this video, we are talking the best way to grieve is to acknowledge, validate your pregnancy, validate the number of that pregnancy, if it was the first or the second. Have time to grieve. Grief goes through stages. You are going to have denial, or yeah, you are going to be in denial. You go the way to anger. You go the way to bargaining. You go the way to depression. You go the way to accepting. So don't force yourself. It's like a class when you lose and they tell you, this is how I want you to handle your grief. Occupy your grief, even if as much as the space. Feel that bottle, feel your heart that you have grieved this person. And then with the time, you are going to reduce. But mostly we force people to accept. Ni kama kufinya tu a sponge of water. It's like squeezing a sponge with water, and the force is to dry so quickly. So grief leaves us with all those things. So don't force yourself to accept the loss so easily. But also, try to go back to normal way of living, where you are able to eat, you are able to sleep, go back to work. And also people ask, how often can I go back to my routine, like having my sexual life? You can do it as from 4 weeks to 6, depending with how your health status is or your mental status is. And also you can even have a family planning. And if you want to get another pregnancy after 6 weeks, you can try to have another baby. And then it is good also to know the cause of the loss of the pregnancy. If you talk to many women, there's nobody, few actually, there are few who have not lost their pregnancy. Majority have lost pregnancy in between. Maybe the first pregnancy you lost 1 or 2 before you get your firstborn, and then in between before you get your secondborn, you have lost another pregnancy. Because we are human beings, we face challenges. So let's support women, don't discriminate them. Let's say that, oh, they aborted, she aborted. Sometimes women may run away and say, she has just aborted my child, she does not love me. You really need support. Society needs to support you. So when you have a loss of a pregnancy, visit an hospital, look for a counselor or psychologist to understand the medical counseling or medical condition. Let them take you through. We're here to support you, so that after few days or weeks or months, you are able to accept another pregnancy, so that you can heal the trauma, because a pregnancy comes with a trauma. Do you know the attachment of you carrying that baby for even a month, even a week, for 9 months, and then you lose that baby? There's that attachment. And even the life you thought that you are bringing life, you want even a name, you work hard for that baby. So if you lost that pregnancy, don't fear, don't fall under temptation of society to hurry up in grief. And then it's good also to try and get another pregnancy, because it will help even you to heal. Because when you lose a pregnancy, it's like now you are not that healthy. It's like you have a bad history. But when you get a live baby, it's like now you are back to your normal health life. So thank you for listening. If you find this video useful to someone, share, like, and subscribe so that we can form a community or support each other. Thank you for watching Joseph In-Depth Connection or JM Cardono In-Depth Connection.